good to see you back. Like I said, we haven't seen you in 10 months. You said you had a hiatal hernia surgery.
Yeah, and they cut my stomach.
So when he got inside, he realized it was too big and said he couldn't do anything for it?
He left that alone.
Okay.
I told him he can't do it, leave it alone, because he the one time he can do it. But my other doctor at Georgetown said that it couldn't be done. And he, said he ain't been told me leave it alone. But when I went to get a second opinion, John Hopkins said he can do it. Said he know my doctor and they friends and this and that. And he can do it. And I said, if you can't do it, don't go messing with it.
Okay.
So he left it alone. But I was able to breathe better, thank God.
So what did they do about the hernia? Just leave it and not...
Leave it.
Okay.
Yeah, they left it. He moved, what did he do? He pulled my lungs down and my heart, something. He did a whole lot of, pulling, opening while he was in there.
Okay.
So I can breathe better.
Okay.
Because I had asthma real bad.
How's your blood sugar doing through all this?
Look, when I went to my doctor, they took me off them metformin pills about 6 months ago.
Okay.
Said my blood sugar was good.
Gotcha. So you're not taking any medicine for the diabetes right now?
Not right now.
Okay. So how are you keeping everything in control?
After I had that surgery, I don't eat like I used to eat.
Okay.
Can't eat like that.
Yes, ma'am. Good luck.
I lost a lot of weight from that surgery.
How much do you think you lost?
I stayed in there 3 days. 2 days? Yeah, 2 days.
Stayed in the hospital for 2 days?
Yeah. Oh, them things, I couldn't even do nothing with these toes.
You have, significant arthritis, right?
Yeah, that's every time I go to the doctor, that's all they tell me about arthritis. I go for my shoulder because both my shoulders were replaced.
Okay.
My back surgery 2 times. And everything is arthritis.
What type of arthritis do you have?
I had the
Osteoarthritis?
Yeah.
Okay. So it's not rheumatoid arthritis then?
Well, 1 minute was rheumatoid, then it's osteo. Whatever.
Okay.
I had rheumatoid arthritis when it started out. They don't give me so many names.
So what's being done for the arthritis now?
Nothing, because my arthritis doctor said, he don't want to give me, I just take, Tylenol extra strength.
Okay.
Because he don't want to give me nothing. He don't want to give me all this cream, because he said some of that cream can cause cancer. So I said, no, don't give me.
Okay. All right.
He said, just try to live with it. I said, I don't
Just try to live with it. What kind of plan is that?
Huh?
What kind of plan is that?
He ain't give me no plan. Because he said he didn't want to. I'm in pain 7 days a week, and that's no lie. And nobody want to do nothing, so I said, well, as long as I'm living, I just live with it.
Have you been to a pain specialist?
I went before, but I don't want to take all that stuff they give you.
Okay. So what are you doing to manage now?
I take Tylenol extra strength.
Okay. And how helpful is that?
Huh?
How helpful is that?
Nothing.
Nothing. Now, when it comes to your feet and your arthritis, how are your feet feeling?
It's so.
What does so mean?
You know, 1 minute is okay. I mean, it do okay, but it be, you know, pain, like, sometimes be in pain. You know, my foot be hurting.
Mm-hmm. Where are you feeling the pain in your feet most? Where in your feet?
Under my feet.
On the bottom?
Yeah.
Okay. What about the toes themselves?
And the toes. I don't know why I get sharp pain across my toes.
Well, one, you have the arthritis, and two, you have the diabetes. So more than likely, what's happening is that you also are having neuropathy. Are you familiar with that term?
What is it?
Neuropathy, just
What's that?
nerve nerve issues.
Oh.
We see that a lot in our diabetics, especially our long-term diabetics. How long have you had diabetes now?
Oh, wow. So long I forgot. I know over 20.
Over 20 years?
Yeah.
So why we also did your circulation test this morning to see how your blood is flowing.
Right.
We'll have the results in that next week.
Yeah, she had told me. I pray everything be okay, because I tell you, I'm tired of everything going this way and that way.
Yes, ma'am. Now, another thing I'm going to do for you, because you have the combination of issues, right? You have the arthritis, rheumatoid arthritis that's affected your toes and giving you all these toe deformities. And you have the diabetes with neuropathy. I'm going to prescribe diabetic shoes and insoles.
Okay.
That'll give you more space for the toes, so you're not getting this rubbing like you're getting to cause the corns on the top of your toes.
Okay.
And also keep your feet protected.
I appreciate that.
Got this build up between the toes. We gotta get that taken care of today too. Well, it's good to see you back.
I'll be back. I just been dragging because I ain't been sick.
Mm-hmm. Now that you're back, and you're back on your feet, we get you back in the every 2-month rotation.
Yeah.
Keep things in check.
Yes.
Again, we did your circulation test this morning. We will have the results back in a week. We'll give you a call and go over that
Okay.
and see if there's anything that needs to be done about the blood flow.
Okay.
Okay.
And you can give me the paperwork for my shoes.
That is correct. So you have the Medicare, so you qualify for the diabetic shoe bill, which means there's a form we fill out. There's another form that your primary doctor fills out to show that you're being treated for diabetes.
Yeah, I had that before.
Mm-hmm. All right, you're here. Looking much better, my friend.
Yeah. Much better.
Mm-hmm.
Look like they gone the last night out when I came.
I'm glad you're looking better here. Glad you're feeling better.
Yes.
The shoes are going to help.
Yes.
The shoes and insoles is going to help things out as well.
Yeah.
You keep on recovering from your surgery.
Yeah.
All right.
I ain't letting them do no more surgery on me.
No, ma'am.
No.
All right. Very good. Looks good.
Thank you so much.
You're very welcome. This is Kevin Jefferson, the DC Foot Doctor. Thank you very much for watching this video. Like it with a big thumbs up and subscribe to the channel. Ring the bell so you will know when a new video has been uploaded. Share it with your family and friends. If you leave a comment or a question, it may be featured in a future video. But most importantly, take care of your feet.